Okay, my name's Andrew, and I'm one of the facilitators with the Kidney Foundation. We're here at St. Michael's Hospital in the reference room. And the presentation today, we have a special guest that's going to talk about you and your mental health. This is being recorded to show up on our YouTube channel. If you do not want to be identified, maybe accidentally in one of the screens, please turn off your camera and nobody will see your name. And please mute your microphone at this point. After the presentation, the regular meeting will occur, and at that point, the group will get much, much smaller as to those that are very specific to why we meet here once a month. And I believe that's it. I'll hand it over to Courtney and Mia, and they will introduce themselves and begin the presentation.
Okay, great. Thank you. So hi, everyone. My name is Courtney. I am a social worker at St. Michael's Hospital, and I have Maya with me, who is a social work student at the University of Toronto. She's also going to help me present, and she was tremendously helpful in putting a lot of the slides together. So I just wanted to acknowledge all of her hard work. At St. Mike's, I work with people that are admitted to the hospital for nephrology and urology and ENT and ophthalmology. From an outpatient perspective, I work with people who are doing in-center dialysis on Tuesday, Thursdays, and Saturdays. So I work with probably just over 100 dialysis patients. And something else that's really interesting that I've done is I took a leave for a year in 2016 to 17, and I did a master's in bioethics. I thought, you know, there's a lot of different ethical issues that come up in the world of kidney disease, and St. Mike's was kind enough to give me that leave. So that's just something just to know about me. In today's presentation, I thought it would be helpful to review the role of a hospital-based social worker. What is our scope of practice? Specifically, what do we do? How can we help you? Our role is quite broad, and it's hard to always know all of the different things that we do. So I thought it would be important for me to talk about that. I also want to talk about how chronic disease can impact your mental health. And we're going to suggest some ways that you can cope with your mental health, and we'll just review some resources and some supports, just so people walk away with some tangible skills. I should have said next for the slide, because that is, yeah, those are the goals. So we'll just keep that up for a second. I'm going to review, discuss how chronic disease can impact you, and then we're going to talk about some specific strategies. Okay, I'm going to pass it over to Maya for a few slides.
So, hi everyone. Again, I'm Maya. I am Courtney's placement student this year. And so we're just going to go to the next slide here. Ready? So all of us have mental health, of course, and mental illness can be defined as any behavioral or mental patterns that significantly impact our day-to-day. So here we can see from the Canadian Mental Health Association that 1 in 5 of us are impacted by mental health. And by 40, about 50% of the population will have had experienced a mental illness. So on the next slide here, the diagnosis of chronic kidney disease can be very shocking and come with a lot of different feelings, including grief, a sense of loss of control, a feeling of isolation, and depression and anxiety are very common in people with chronic kidney disease. We can see in this slide.
I'm sorry to interrupt you. We have a message. There are some people who are unable to see the slides as you're showing them. So I don't know if that's something that Andrew can help you work out, or if it's something that's local to them. But Andrew, would you be able to have a look at that?
I think Steve is here. Stephen will.
I think they just rejoined, so they may be able to see now.
it's
Fair enough.
an issue on their end. Yeah.
Okay.
Yeah, sorry about that. Hopefully that works itself out. And so, yes, on this slide, we're just seeing that some estimates indicate that depression can affect around 50% of people with kidney disease at some point. So the next slide, we have a video. And at the time. We're just going to play a little snippet of this video from about 49 minutes in, if we're able to zoom ahead to 49. Maybe we can pause it there now. Thank you. So that video is available on YouTube. It's the hidden scars of kidney disease and mental health. And just in that clip, they're just kind of normalizing for us how these changes will happen during these major transitions in our life. And there's a lot more great information in the video as well, if you're interested. But just continuing on here. So of course, there are many things that determine our health. And so this is just a graphic on the social determinants of health, which includes economic stability, social context, your neighborhood and your environment, your healthcare, as well as your education. And so we've just brought this here just to kind of acknowledge that social workers do think about all of these different determinants of health. On the next slide here, we've found that in research, they suggest that the best outcomes of care come from an interdisciplinary team, which would include a social worker, as well as the other doctors, nurses, and team that you would see. And I'll just pass it back here to Courtney.
Okay, so we're just gonna move slides. Okay, so I just wanted to spend a little bit of time speaking more specifically to the role of a renal social worker in a hospital. I think what's important to know about us is we look at the big picture of what the patient is going through. So your physician is obviously very specifically going to be looking at your kidney function and what treatments you need. But something that we do is we're assessing your home environment What is your income like? Is that something you need help with? What about education, employment, mental health, social support? So what we're trying to do when we assess you, when we first meet you, is paint a picture of what your life looks like when you're not interfacing with the healthcare system. So we really want to get to know you, what is important to you, and what resources and supports you need. Then we're able to intervene. So once we assess and we get all of this information, we might help with housing. We might provide some financial counseling. We might help you develop coping skills to manage your anxiety or your depression. Something I'm going to speak about a little bit later is advanced care planning and what that means and helping you identify a substitute decision maker. So we really want to make sure that the treatment you've chosen aligns with your values and your wishes. And we want to bring your voice to the forefront and help you achieve your goals. Our next slide sort of shows a few different bubble topics. We just go one more slide. Yeah, there we go. Or we just want to get our bubbles up. Oh, no, sorry. Let's go back to the bubble. There we go. I just wanted you guys to sort of have a visual of when I say wider context, what exactly do I mean by that? So finances, mental health, home environment, education and employment.
So what 1500 about just this thing of OPI.
Yeah, so anyways, I just wanted you to have a visual to see all the different things that we do. So you can get a sense that the work we do is quite broad. The spectrum is quite broad. There's lots of different issues and questions and topics you can bring up to us. But I think the most common way to look at it, or a general theme, is almost all of the non-medical things. Everything else that's going on in your life besides your disease, but how your disease is impacting your finances and your mental health and vice versa. So I'm just really trying to get a sense as to where can we help you outside of the disease specifically, but making sure that you have an income and making sure that you have transportation, for example. So I'm just going to move slides just to explain how the next slide, how we sort of assess and how we get all of this information. So when we first meet with you, it's most ideal that we do a psychosocial assessment. And this is sort of a quote that I've already said, but it's something that I wrote in a paper once, that the psychosocial assessment allows us to paint a picture of what your life looks like when you're not interfacing with the healthcare system. So that's really the goal of the assessment. Let's move. I'm going to give you a case example because sometimes case examples best explain.
Cancel code white. Attention, attention. Cancel code white. Attention, attention. Cancel code white.
Okay, so we're going to meet Joe. Joe is a 35-year-old man. He worked in construction. He lives in Scarborough. He was recently diagnosed with chronic kidney disease. He's currently unable to work. His family does not live close by. He's anxious about the changes of daily life, including finances and communicating with friends. So first, one thing we're going to want to do is make sure that he understands his diagnosis. Sometimes when things are conveyed by a medical professional, it's not always said in layman's terms, and sometimes it is a bit confusing. So one thing social workers do is help translate that information, make sure you understand it. And it's important for us to first understand what's going on with you medically so that we can then convey that information in a bit of an easier way to understand. So with a job like this, construction, heavy lifting, labor, that might be challenging if you are approaching dialysis or on dialysis. I would say that is unlikely to be a job that you can sustain. So a common question that might come up, the most prevalent question for some people, is the stress of finances. Well, now that I can't work, what am I going to do? So it's important to see If you have any benefits, were you paying into employment insurance? Does your employer offer short-term disability or long-term disability? If not, if none of that applies to you, then we might be looking at Ontario Works and applying to Ontario Disability so that you have stable income and stable drug coverage as you manage with your new daily life and your new disease. So when we see things like family doesn't live close by, we want to assess your support. So do you have friends? Do you have a roommate? Do you have a partner? Do you have a community? Do you have a religious group that is around to support you? Because with this big change, we want to make sure that you're being supported. It's very, very common that someone who's young, who now has a chronic disease, is anxious. So that's something we're going to want to talk about and make sure that you have support. It is usually unlikely that the dialysis social worker has the time or the capacity to offer psychotherapy, but connecting you with a psychotherapist or other resources, support groups, etc., which Maya will speak more about, is more common. But that doesn't mean that we're not going to check in with you while you're on the machine. And it's, very common that we get flagged to see you a few times. At St. Michael's Hospital, for example, we do have access to a psychiatrist that will see our patients specifically while they're on the machine. So that to me is an excellent resource. We might want to get psychiatry involved. We might also recommend you speak to your GP, your family doctor, especially if you're considering medications. It depends. So this is just sort of a, not so uncommon case example, but I thought if you saw a person and you had a visual and an age and a diagnosis, these are sort of the things that we're talking about when you wonder, well, what is the social worker going to do to help me? So let's move on. Practical supports. So I would say probably one of the most practical supports that we offer is transportation. Getting to dialysis 3 times a week, it's quite unlikely that people can manage driving, paying for parking. Some people can, but especially with a downtown location like St. Mike's, that's pretty challenging. So let's move slides so we can have a little bit of a visual of what are the practical resources that we're helping with. So housing might come up. If your income is impacted because you're not working, because you're on dialysis, then it might be unaffordable to live the way you've been living, in which case we need to have a discussion about maybe applying to Toronto Public Housing. There might be discussion about moving in with family or other loved ones, just trying to get a sense as to how can we make housing more accessible to you. In terms of taking time off work, it is, some people feel they want to work, and we do have dialysis patients that work, but you might need a letter of support from us. So that's something I would help with. You might want to take a little bit of time off, but not quit entirely or go down to part-time. And if you need any medical documentation, that's something the social worker can help with. We're also going to want to look at federal and provincial government programs to help you return to work or learn a new skill. So looking at other types of employment, because some people, they can't do their typical day job, but they would like to do something else. I did mention transportation, and Wheel-Trans is probably the most common transportation resource that we work with. But there are some other opportunities. There is some funding from ODSP, which is Ontario Disability Support Program, to take some taxis. It just depends on what your situation is, but that's something that we talk to you about and we try and help you navigate. Just in general, we're always looking for funding for patients. We're always looking for new programs. If we have to look something up, it doesn't always mean that we don't know what we're doing or we're not able to help. It's just that programs are changing all the time. There's new programs, there's the termination of programs. So I would say it is part of our job to almost be expert Googlers. And it's very common for me to liaise with other social workers and just to learn what is the latest program out there. So that's a pretty common part of our job. And then, of course, mental health. We're going to want to ask you questions. Do you have a diagnosis? Have you ever seen a therapist? Do you have any access to counseling? Have you ever been on medication? Because if you have, and now you're experiencing a new lifestyle with a chronic disease, then that can definitely heighten what's going on with your mental health. But then, of course, there's also people we're screening for the first time, and this new lifestyle change can bring on a newly diagnosed mental health issue. I'm just gonna move slides and talk a little bit more about financial resources. So it's quite common that we're dealing with Ontario Works, which gives you access to income. I'd say a more common term is welfare, but it's sort of an older dated term. Ontario Works is the up-to-date accurate term. And maybe helping you switch from OW to Ontario Disability, which is the acronym ODSP. A lot of people who are working are paying into CPP, Canada Pension Plan. We can tap into CPP a little bit earlier if you have a chronic disease and meet criteria. Just because you've been diagnosed with CKD, nothing is a guarantee. We can't promise that all of these resources are going to be a guaranteed yes, but we are more than happy to help you with the application process and guide you and advocate for you and try and get you access to these resources. So, we might have a conversation about what is CPP disability and doing the paperwork. Something else we can do is the disability tax credit. Let's just say you didn't know about it and you've been on dialysis for 3 years. When we complete it, they ask what year you started dialysis, and they ask you if you'd like us to backdate. So there's always the opportunity to get some money back off of your taxes. And even if you haven't done it, we can backdate. So that is something we're always happy to help with. Dialysis does qualify under life-sustaining therapy for the disability tax credit. So when I did say you're not entitled to every single resource, that is one I'm fairly confident you're always entitled to once you reach the stage that you're on dialysis. Also, when it comes to seniors, helping you apply for old age security once you turn 65, or helping you access CPP for retirement. None of these things are automatic. We need to apply for them. So helping you with the paperwork is a common question that we're asked and something we're very able and happy to help with. It can be very overwhelming to try and figure out what category are you in and what should you do. So that would be a great time to get us involved and ask us. And it's common for us to sort of figure out what category you're in based on your age and whether or not you worked and where you are in your career, et cetera. And also looking at other financial supports. So I'd say one way to avoid a lot of frustration and stress and anxiety is to understand your options and talk to us about them. You might also have insurance coverage through work or other benefits, and that's something we want to help you with. But I will put a disclaimer, we are not accountants, even though we definitely get asked super specific financial questions. We might refer you to a tax clinic or to an accountant, and there's tons of resources also where we can help people that don't necessarily have the income to pay for someone who's a CPA privately. So we can also guide you to free tax clinics based on your postal code. So let's just switch gears a bit and go dive into emotional health and mental health support. So kidney failure can come with a big shock. It's a big adjustment. This is now your new normal, and needing emotional support is common, it's reasonable, it's expected. So we want to talk about your feelings, and we want to talk about this big transition and what are you fearful about and what are you concerned about, because we want to help address as many issues as we can, give you tips and tools for coping with a new diagnosis, help you process this new changes in lifestyle. We can't necessarily completely take away anxiety or depression, but we want to at least best address them and help you as much as we can. And I'm not saying it's always the social worker that addresses the issues, but we're often one of the first contacts. And then we're resourceful. We often know, okay, should we be looking into a psychiatrist? Should we be looking into external mental health resources? That would be fully in our wheelhouse to try and help you manage and figure out what resources do you need. We're also going to encourage you to communicate and get support from family and friends. You know, not to say that you need to disclose everything about your health to your friends, but it is, I think, helpful if you're open and then you can be honest and get that support and let people know what's going on. So let's move slides. This is also just another little visual. These are things social workers can help you with. Are you feeling anxious? Are you feeling down? Are you experiencing excessive worry? Are you concerned about your kids? Or have you experienced the loss of a loved one? Are you feeling hopeless or stuck? So, you know, kidney disease might be one thing that you're experiencing, but then there might be a whole host of things happening at home that are not related, but because you're in a vulnerable position, those things that come up are even more stressful. So when you experience a loss of a friend while you're already going through this new life change of dialysis, I would not be surprised if that loss is even more significant, or the experience of that loss is more significant because you yourself are struggling right now. If we go back to Joe, of course, at 35 years old, now being told you have chronic kidney disease, you're going to have to go on dialysis. We can consider a transplant, but do you have a live donor? These are really stressful life events, and we do not expect you to coast through them and not have any issues. Quite the opposite. It is an expectation based on all of the research that we have that you are probably going to feel anxious and you are going to feel down. So, you know, what we want to do is help. How can we help? What are things that might work for you? What works for you might not work for everyone. So we definitely don't have a one size fits all model. Moving on, I know the Kidney Foundation is hosting this session. In no way have they influenced me to put up this slide, but the reality is they are a really prominent, prevalent resource that we use. You know, there are things like travel loans, there are things like short-term financial assistance, reimbursements for live donors, summer camps. They're a great resource, and I'm often in touch with the Kidney Foundation and connecting patients. Everyone, a lot of you probably know that the walk is this weekend. So it's great to get out and provide, you know, support and see other people that are going through what you're going through. They also have like tips and tricks around tax season. There's just so much that they offer that I find is really beneficial for patients. Next slide. Most prevalent to me as a social worker, or something that I'm constantly referring back to, is the peer support program. It is very common when people will say to me, do you know anyone that's gone through this? Is there someone I can talk to? Or, you know, I'm nervous about getting listed for a transplant. Can I talk to someone that's had a transplant? I think it is only most appropriate to go to the peer support program because these are trained volunteers. I'm not going to go up to a patient in the dialysis unit and put the onus on them to talk about their experience and be a volunteer. I think it's only appropriate that we utilize resources where people have experience and training and a desire to speak to about what they've been through. And it's, you know, common in many sectors that we want to talk to people that have been through what we're about to go through or currently going through. I think kidney disease, it's not a well recognized disease or well understood disease. You know, we hear a lot about different cancers. But growing up, I wouldn't say like dialysis was common language amongst people that I know, but hearing that somebody had cancer is. So that's where I also think peer support is really valuable because this disease is not something we know so much about. It might be great to speak to someone, to speak to a trained volunteer, and hopefully they'll be able to answer some questions. The feedback that I get is only very positive. So I'm definitely going to plug the peer support program. And if you go to the website, you can get a phone number. So it's also important that we think about your loved ones and offer them support as well, and recognize that you're part of a system and you have people that are also being impacted by your disease. So I'm just going to skip to the next slide. There is both practical and emotional support that we can offer. So very common for us to speak to your spouse, speak to your parent, because they're struggling too. This is a big change for them. You know, your overall well-being impacts your family and impacts your loved ones. So we need to be realistic that they are going to be affected. There's also some really practical benefits like taking a caregiver leave from work. If you're critically ill, for example, if you're in the ICU, if something totally life-changing has happened, then there might be a paid leave from work. So we want to also work with your caregiver. We also want to prevent burnout. So we want to be realistic. You know, sometimes that first family will say to us, I'm going to drive my loved one to dialysis. They are not taking Wheel-Trans. They are not taking TTC. But I think we need to be realistic. And often I'm encouraging to utilize transportation resources because that can be pretty exhausting and take a big toll on family to be driving 3 times a week to different ways. I hope our slides are still there for other people to see. There we go. I think we're on slide 22. So anyways, feel comfortable introducing us to your family, bringing your family forward. And, you know, we want to support them. Something else that social workers do is advanced care planning. And it sounds kind of self-explanatory. We're just planning for the future. Just because we want you to participate in advanced care planning does not mean we think you're dying. It does not mean we think you are imminently ill. In fact, we actually think you're well enough to participate in a conversation of advanced care planning. So yes, we might want to talk about end-of-life care options and what are your values and preferences, who's going to make decisions for you, etc. But just because we're having those conversations and they are sensitive and they are scary, it doesn't mean we're worried about you. We've actually been mandated by the Ontario Renal Network to have advanced care planning conversations with everyone who is new to dialysis, for example, because we want you to be able to advocate for yourself. Should there ever be a time where you cannot speak for yourself, we want to ask you important questions while you're well enough. So me, for example, I've already done a power of attorney. I've had conversations with my family. So I'll explain and unpack what some of these terms mean, just so you're aware. So how to get started. Next slide. You know, big picture, we want to understand what is important to you, what is important about your life and your health. How do you feel about your life and your health right now? You know, we want to understand your support systems. Are there any situations where maybe you would want to stop dialysis? Is dialysis an acceptable quality of life for you? Under what circumstances may that change? So yes, these are difficult conversations and these are difficult questions, but we at least want you to know that we are comfortable having them. And, you know, we have been asked to have them for a reason. You know, anyone's health can change at any time, regardless of having chronic kidney disease. Accidents happen, acute things happen, and it is good and valuable, I think, to just have conversations. We have designed, for St. Mike specifically, we've designed a little pamphlet with just some basic terms. I'll explain some of them now that we give to our dialysis patients, just so they know that this is something we want to talk about, and we want to give you a starting place. We want to give you something tangible, something you can read so we can discuss it. So let's move to the next slide. We're going to talk about substitute decision makers. So everyone in Ontario automatically has a substitute decision maker. We only get them involved if you are incapable of making decisions. So for as long as you're capable of making decisions, there's absolutely no need to get them involved, but it is great to know who they are and document who they are, figure it out, have it in your chart, just so we know who to contact should you not be able to make decisions. The next slide shows the automatic hierarchy. So as you can see, I'm going to talk about a power of attorney on the next slide, but if you fill out a power of attorney, it always trumps who your automatic substitute decision maker is. Number 4 is probably our most common one, your spouse or partner being your automatic substitute decision maker. But then it goes down the list. So if you have a spouse, they would be the first person who's your automatic SDM. If you don't have a spouse, but you have children or parents, then we just keep moving down the list. This is something we discuss with you. We figure out with you, who is this substitute decision maker? Who is your substitute decision maker? The next slide, I explain what a power of attorney is. So this is where we can appoint a substitute decision maker and put it in writing. You don't need a lawyer to complete a power of attorney. We can do it without one, but you're also entitled to consult a lawyer. It's up to you, but there is a free resource online and we can help you fill it out. If you fill out a power of attorney correctly, that is the person we would always call if there's an incident or an event or a time when you cannot make a decision. So let's say you are married, but you don't want your spouse being your automatic SDM to be your SDM. You want to assign your sibling. So if you put that in writing, that's always going to trump that SDM hierarchy. So, I spoke to somebody about this yesterday and I basically said, this is about you and this is about being able to advocate for yourself. You pick the person you want us to call. And what's most important really is having a conversation with the person that you assign about values and preferences and try and come up with some scenarios as to a time where maybe you would no longer consider dialysis or a time where you wouldn't want to consider keeping your transplant going anymore. And we have resources to help guide these conversations, but social workers are always around to help guide them. I'm going to give one more case example before I pass it off to Maya again. I just wanted to show, there's such diversity with our patients. So, the first example I gave, Joe is 35. Now we're going to meet Sue. This is an example that I found in the literature, but this is totally something common that I would come across. So she's 80 years old. She has diabetes, hypertension, coronary artery disease, and chronic kidney disease. She got referred to a nephrologist. She now needs a walker, so it's getting a little bit harder to get around. And she needs some help with daily activities like getting dressed and meal prepping and getting around to appointments. She's feeling like she has less energy. She's more fatigued. She's more tired. She's losing some weight. But she does have the support from her daughter and 2 siblings. So right away, we see that she has not been started on dialysis, but she's been diagnosed with CKD. So we would maybe want to have a conversation with her. Is dialysis something you would want? We're not going to be ageist just because she's 80, just because she has a walker. That might still very much be on the table if the nephrologist thinks it's a legitimate treatment option, which it may. So in the literature, in this case, she chose to start dialysis. She wanted to see how it went. And after a little bit of time, she was hospitalized a few times. She actually found it really grueling to get to dialysis. She was finding she was quite weak. We had advanced care planning conversations with her. Her independence was always really important to her. And she said, when the time comes that I can no longer live at home, that's a time where I would not want to do dialysis. So once that time came for Sue, there was a discussion with her about stopping dialysis and what palliative care looked like. And she chose to palliate in the hospital, but it was an option to do palliative care at home. So this is just an example also where social workers get involved. So we helped her with a lot of the resources to get started on dialysis. And then she reached a point in her care where she thought that wasn't an acceptable treatment for her. And she felt comfortable and was capable of making that decision, but had the support of her family. So I'm just giving you that case because that would be another sort of standard example where social workers might help. So as you can see, the spectrum is enormous. Like we might be helping you with Wheel-Trans. We might be having really intense conversations with end of life. We might be talking to you about your anxiety. We might be talking to you about your taxes. So that's why we need to look things up sometimes, because the vast number of questions that we get in a day are so different, that we constantly have to be up to date and learning what's out there and what's in the community. I'm going to have Maya just speak a little bit more now about specific ways we can cope with mental health.
Yeah, so we can go to the next slide here. So as Courtney said, we'll have discussions on a range of topics often with social workers. And we thought we'd just touch on some of the takeaway mental health tools or coping strategies that you might discover together with the social worker. So on the next slide here, if we think back to the beginning of the presentation and considering that there are so many different social determinants of health, including your neighborhood or your social context or your economic stability, your coping strategies will reflect you as an individual and your own context specific to who you are. And so the social worker will always work collaboratively with you to find things that will work within your schedule, within your day-to-day, and that are kind of relevant to your interests and to your values as well. So we thought we could consider mindfulness as a coping tool. And so we'll just look at kind of what mindfulness means within the context of kidney disease.
We can do the next slide.
Oh yeah, the next slide. So we looked at some studies to do with mindfulness-based intervention. And there's a lot of really promising and kind of exciting research that comes from this. So people with chronic kidney disease were found to have significant improvements in anxiety, depression, self-efficacy, sleep quality, and qualities of life when using mindfulness tools. And on the next slide, we'll think, yeah, so what is mindfulness really? It's kind of a word that gets thrown around quite a bit, and it can sound a bit maybe like similar to yoga or these kinds of things, but really mindfulness is just a non-judgmental awareness of the present moment. And so social workers can bring you some tools to help you tap into your own sense of mindfulness. And maybe that looks like considering your 5 senses in a moment or tapping into your own breath. Things like this that just kind of bring us to a more grounded spot and help us to cope with any mental health challenges that might arise. So we do have one example of this that you might find helpful or you might not, depending on who you are. So the next slide, we just have box breathing, which you may have seen before. So we can actually do this together. If we look at the top of the square, it says to breathe in, and the suggestion here is to do each action for 4 seconds. So I can just talk through the box, and if you'd like to follow along, you can, or you can just kind of observe. So we can breathe in for 1, 2, 3, 4. Then we're going to hold that breath for 4, 3, 2, 1. And then we're going to let it go, breathe out for 1, 2, 3, 4. And just hold that feeling for 4, 3, 2, 1. So like Courtney said, we're often not have, or we don't always have the time to do a full kind of therapy in-depth session with people in the hospital, but we might have coping tools like this breathing exercise that you can take with you and kind of carry into your life in a mindfulness way. Okay, I think that's all of our resources for today. I'll just pass it off to Courtney for our last moment.
So we just wanted to put this slide up on 50 ways to take a break. And this just has some really simple ways to just sort of relax, take a breath. So listening to music or petting your animal or putting on a song and having a good dance or calling a friend. And I wanted to put resources up that are accessible to a large group of people. And I also I specifically wanted to put up a couple slides on mindfulness because mindfulness is a strategy that we can use anywhere. That breathing exercise that we just practiced, you can do that while you're hooked up to dialysis. That feeling of being isolated or trapped on a machine for 4 hours, I think it's really critical that we have some strategies about how to calm down, especially if we're feeling a bit panicked while we're on this machine. It's also something you can do on the TTC home. So I think it's just important that we have strategies that are accessible and things that we can take with us on the go. I've worked with people on dialysis for about 10 years, but before that, I worked with youth who were struggling with mental health and addiction. And anytime they were doing really well, I always asked them, what is going well and what is working for you? And the most common response was breathing. And that 4-box strategy was something that I heard over and over again as something that would truly calm them down, bring them back to the present moment, pause on the thoughts about the future, pause on what we can't control right now, and just be present in this moment. So because that was the most common response, I just felt compelled to share it as a strategy. And then, you know, this little pretty visual, most of the things on here are all things that we can do. Take a nap, take a bath, walk outside. I like that these are not particularly expensive or fancy or complicated ways that we can just either go into the present moment or almost the opposite, just distract ourselves from what's going on. Yeah, I know we have a little bit of time. I'm happy to answer questions if people want. If Steve could help, I don't know if I guess there is a chat box here. Happy to take questions, but I want to thank everybody for being here and listening and being present. We're very grateful for your time. I hope you learned something. And yeah, if you want to ask questions, I'm just going to stick around.
Okay, I'll let Andrew Stephen, I'll let Andrew take over as far as the whole moderation, but microphones and cameras are enabled for anyone. So if they want to ask questions either in the chat or in person, it's available. So.
Okay, thank you. First of all, I can't see if anybody's hand is up. Erwin, you may have to help me here. Give me a moment.
No hands up right now. I see a comment, thank you, saying that the presentation was great.
There are no hands up.
Is there anything in the chat?
Nothing in the chat that I can see except for a compliment from Teresa. Great presentation. Thanks so much for taking the time to share.
There's no charge. Look after yourself. Promise me.
If anybody would like to ask a question of our presenters, and you are able to, you can click on the icon where it says raise. That'll show your hand up, and then we can call on you and you can ask your question of Courtney or Maya.
Again, this has been recorded, so you will be able to watch it again on the YouTube channel. If you go to Kidney C8, and there is
Catherine
a question.
has a question. Catherine, unmute yourself and ask a question, please.
Hi there. Thank you very much. Sorry, I was a bit late joining, but very helpful. I know I think two-part question. One is we are assigned a social worker as part of our nephrology team. Is that the person that we go to for all of these things?
Yes, so I mean, all the things that I mentioned.
Yeah.
I would say most of what I talked about is pretty standard for what a dialysis social worker would help you with. And yes, once you start dialysis, you're assigned someone. So let's say you were following clinic before dialysis, that person changes because we get that question a lot. So you might have to get to know somebody new and a bit different. But yeah, I think everything I said is like pretty standard. I would I would expect that whatever center you're with, that your social worker would help you address everything I just addressed.
Okay, thank you.
Anybody else with questions? We have some comments. Henry, you've raised your hand. Unmute yourself and you can ask your question.
Yeah, I find most of my anxieties revolve around not having a life partner. I've also lost my driver's license, just as a side note. So finding a life partner, I find extremely difficult, and almost always when introducing myself, who I am, everything revolves around my taking care of myself. I've got vascular problems and kidney disease, and I'm on dialysis. So that scares people away for the most part. What I would like to see is a dating service where kidney patients can meet other kidney patients in a social environment, because I think sharing that issue would make it easier to meet a life partner. So that's my issue, and that causes me the most anxiety. I'm lucky because I like myself. I don't mind living alone. I got a cat. I'm good, but I'd like to be better. And that would include a life partner, you know, either sharing both our health concerns or just having somebody to watch a movie.
Mm-hmm. Thank
So
you.
I haven't found anything. Dating has changed. A lot of it has changed because of my condition.
I want to just first say thank you for being vulnerable and coming forward and giving, I think, two very real examples. Dating for sure, and not losing your license, not being able to drive, take kidney disease out of the picture. But in general, when we can't be as independent as we want to be, then that can be really difficult. And I love your suggestion of some type of social/dating event. And you've brought the idea forward in a great forum, because the Kidney Foundation is present, and that's also something I can take back to them. I love that. That's great. Thank you for sharing that and suggesting that. And I think, the challenges that you have are unique, and it makes sense that you would maybe want to meet someone who's going through something really similar. I see a hand.
Samantha, why don't you
Hi.
unmute yourself? Hi there.
Yeah, hi. So I kind of have a bit of an issue. I'm not I'm almost at the dialysis point, but not yet. And I've been at this level. Like my GFR is like 15, but it drops to 11 frequently for like 2-3 years. And I believe that Ozempic is helping me with my kidneys. I think that's what's helping me prolong. But there's no coverage for it, and I can't freaking afford it with all my other medication. Like, I don't want to stop it because I think it's holding off dialysis. Like, are there any programs for that, or?
I know from speaking to the pharmacist, there's some coverage for Ozempic based on what it's being prescribed for.
Only if you're type 2 diabetic, and I'm a type 1.
Right. So I definitely don't have anything, unfortunately, novel to say, other than if you have spoken to your nephrologist and a pharmacist in your clinic and a social worker and there's no coverage for it, then I guess it comes down to also like a values decision about, is this something you're gonna keep? I mean, legitimately, can you keep paying for it? Are you going to keep paying for it? I mean, I don't know of any other programs offhand, but I can think about it. Or you can, do you have access to social work in a clinic, like a kidney care clinic?
I have no idea who I was introduced to her once over the phone, way back when I started at the kidney clinic. And like, I haven't heard of her since.
Yeah, so you know what? It's totally reasonable to reach out to them, and if you don't know their name, ask any staff at the clinic, ask the nephrologist, call the clinic, get their name. I mean, it's always worth
Okay.
exploring just to see if there's like any specific funds through the program, the hospital. But yeah, I knew there was some funding based on what the criteria was. But I encourage you to at least ask and don't be shy. Just see what they can do, if
Yeah,
anything.
okay. I just think it's really weird when I stopped taking it for a bit because I was like, I'm not going to do this anymore. My GFR dropped.
Well, that is certainly in the realm of the nephrologist to comment on.
Yeah, like 6 points it dropped.
Interesting. Oh, someone is writing about a drug that is available to help slow down kidney decline.
Oh, okay.
And somebody, I don't know, there's a few things happening in the chat. Okay, but that's great that somebody you can reach out to, or they're mentioning a drug that you can ask about.
Oh, okay.
Again, the comments in the chat are just people's personal experience. It is not medical advice from us. It's just other participants commenting.
Okay, thank you.
So there is somebody, Barbara Goff has a question. Barbara, just unmute yourself and you can ask your question of Courtney and Maya.
Hi, thank you for doing this. It's a great presentation. I apologize I came in late. So I don't know if you touched on this or not. You did touch on the fact that there are some short-term financial assistance and then longer term through the government. What I'm wondering about is financial assistance for northern travelers, aside from the Northern Ontario Travel Grant, who have to travel for transplant. So I live in the north. I'm right now going through transplant workup. If I am successful and have a living donor, I will have to live in Southern Ontario for 6 or more weeks. And I'm on pension, a small, just government funding pension, and don't have a lot of savings. I've been told it could cost anywhere from $10,000 to $30,000. So to live down there while you're there for aftercare, because you have to be there for that length of time. And if there are complications, then you're there for longer. I have a friend who's down there right now, has been down there since May, had a transplant. She's been home for 16 days in this whole total time. And this is coming out of her pocket, and she's an artist, so she doesn't have a lot of money. So are you aware of any more substantial financial assistance for people who have to travel and live where the transplant centers are? Because there's nothing in the north. So we have to.
I know, it's really unfortunate. Your question specifically is around like the cost of living to live closer to a transplant center.
To receive the care you need.
Yeah. Besides the Northern Travel Grant, no, I'm not familiar with anything else, and that's a gap. That's an issue, and I've seen it, and it's a struggle. I wish I had a solution to that.
I do too.
Oh, someone's saying you're in a front. Oh, sorry, that's something else. Stay well. Not sure what stable is.
That's the person's name.
Is that?
Sally Ann, could you elaborate on what stay well is
Yeah.
in the chat? And while you're doing that, we'll go to Catherine, who has a question. Catherine, if you want to unmute yourself and ask a question, please.
Oops. Yeah, there we go. It's actually not a question. I know that I thought there was travel and housing allowances when a donor has to come and be at the same location as the recipient. So I just wondered if that's not something, that's something within that, because I know like at St. Mike's, the living donor program says if someone is coming from somewhere else, there are some allowances for it, and I don't know what they are or who organizes it, but I do remember hearing that, reading about that.
Yeah, there is a program called Pre-Laud that's accessible to live donors. So if you're being worked up as a live donor, the social worker who assesses you in that clinic would talk to you about your options, but that is specifically for the donor, that program.
That's unfortunate. Okay. Yeah. Okay.
No, it's a fair point. I mean, it's also good for people to know that there is some funding for live donors.
Yeah. Okay.
If you Google the word stay well, you will get information about it. And the only thing I see here very quickly is it just says that they also have hotel partners and guarantee a 20% discount, but they seem a little bit more than that. So it's actually called, I guess, staywell.ca. If you start there, you can see some information.
That's so interesting. Yeah, when I look at their partners, Sinai Health System and UHN is listed. Unity Health is not, so we're not a partner with them, but that's maybe why I didn't know about it. But thank you for sharing that. Always up for learning new things, and I'm glad that we can share this in the chat. Oh, okay. Great to see that it was more than 20% with Stay Well.
Okay, Erwin, it's been an hour, and obviously, Courtney, this has been a wonderful presentation. You can tell by many of the comments in the chat.
Yeah.
And Maya. Oh God, I got your name wrong. Okay, thank you. And what we need to do here is there are a few people who are registered for just the part of the regular meeting. The others that have just come for this presentation need to disconnect. You may find yourself disconnected if you're registered for the regular meeting, which we have every month.